Dr. Alleyne here with Alleyne Aesthetics at Renaissance Plastic Surgery. And a question I'm often asked, what is the correct age for a face or neck lift? In the last 5 years, that's now changed because the GLP-1s, rapid weight loss is at an all-time high. And the issue throughout the body, especially when we talk about body contouring, is with that volume loss, the skin is often left with the problem of rebounding back. And the issue is after a certain amount of weight loss, which we call massive weight loss, anything basically over about 50 pounds to 100 pounds, the skin does not have that elasticity in the dermis to snap back anymore. So you're left with loose skin. We see this a lot in the body, but it's also present in the face and neck. I'm seeing patients that they're happy with their weight loss goals and how Ozempic has worked for them, but they're like, I never had this before, this excess skin, or why does it look hollow underneath my eyes? Well, the issue is GLP-1s, it's targeting weight loss everywhere. It's everywhere evenly. So even volume we want to keep in the face, we're losing that too. So we have volume loss in the cheeks. When these start to descend, we start to see our orbicularis retaining ligament, that line underneath the eyes. We start to look more tired. We're also seeing people younger and younger having nasolabial fold. That's also because of the volume loss. What brings in most people is very fast volume loss, especially in the neck area. Anybody after about age 20 has less ability to rebound back. So as you can see on someone with a crisp cervical mental angle, and we're very far from that angle and not being acute, we're more obtuse. Once you've lost the fat compartment volume from that area, that skin unfortunately cannot just snap back and it's left static and loose. For people now in their even early 30s, I'm seeing consults for direct neck lift, even some people that need a full deep plane face and neck lift together. We used to not offer that technically as plastic surgeons in people that young until this introduction of such rapid weight loss. What we're really trying to accomplish is a multi-layer modality way to treat this. So removing the excess skin, trying to get the neck to be that crisp angle again, tightening the muscles to prevent any issues with subplatysmal fat from pouching through as they've lost weight and now the muscle weakness is evident. Resuspending the SMAS, the muscle layer that you can see in the upper face, and then also volumizing. Using fat grafting, I always tell people you're going to want to be off of your Ozempic or GLP-1 at least for a month before and then hopefully 2 to 3 months after this procedure. Why? Well, if I'm using a little bit of fat from the abdomen or inner thighs and I'm revolumizing fat in the face, that fat is super sensitive to further weight loss. If you're doing HIIT cardio or anything like that right after this procedure, the first fat to be lost is the fat grafting fat. So we want maintain your caloric intake, hold the GLP-1 momentarily, really do everything you can to maximize your nutrition and calories because we want the fat that's added back to the face, we want that to stick and stay. So after about 2 to 3 months, it becomes stubborn fat. At that time, you can resume your medications and higher activity level. That's basically how we treat that Ozempic face and neck, and we're seeing this now in younger and younger patients.